Good day. I am Monica L. Minorias, a second-year student nurse from University of Cebu Benillet campus. For today, I will show you how to do the Perilite Exposure, which is the application of the dry heat to the perineal area with the aid of the Perilite lamp to be placed 18 to 24 inches away from the perineum. The purpose of this procedure is to provide comfort, to increase blood circulation to the surrounding area, and to promote quick wound healing. Before doing the procedure, first of all, we need to review the physician's order. It is very important to validate if the treatment request is prescribed by the doctor. In the doctor's order, it's stated here that for Perilite exposure, 15 minutes on duration. So you have to note if the treatment procedure is indicated for the correct patient. You have to know or to take note the complete name of the patient, the date and time, the Perilite exposure is ordered, and the physician complete name and signature. Gather all the equipments that are necessary for the Perilite exposure. Make sure that all the materials are complete before bringing to the patient's room in order to save time and my energy. So the materials needed for the Perilite exposure are the Perilite lamp. So as part of my preparation, I need to check the function and the safety factors of this device. So we will check the cord for its cuts and abrasions. Then we will plug and heat the lamp. And check for its proper function. Then we have for perineal flashing, we have the warm water, the cotton balls, the betadine cleanser, the alcohol, the picking forceps, the towel, the clean gloves, the incontinent pad. This is used to absorb any discharges that comes out from the perineum. Then we have the bedpan. So bring all the equipments to the patient's bedside. Then introduce self and check the patient's identity. So good morning, ma'am. I am Monica L. Minorias, your nurse for today. So I will be doing a perineal exposure to your perineum. So can you please tell me your complete name and your birth date, ma'am?
Okay, my name is Shahara M. Orlando, and my birthday is November 25, 2010.
Okay, ma'am. Thank you. So next, we will explain the procedure to the patient to elicit cooperation from the patient. So, ma'am, this procedure is actually prescribed by your doctor. This is to hasten your wound healing and to increase your blood circulation to the surrounding area and to provide comfort. So, a heat lamp will be placed not too close to your perineal area and it will stay there for 15 minutes. This is a reminder that prior to the start of our heat lamp treatment, your underwear should not be worn throughout the demonstration of this procedure. Would that be okay to you, ma'am?
Yes, nurse.
After getting the approval, don't forget to ask your patient to void first, because this is to avoid interruption during the procedure. Remember that heat can stimulate the patient to urinate, especially when the bladder is full. Since the patient is able to go to the restroom after voiding, then do the perineal cleaning, then give a quick reminder to the patient that underwear should not be worn throughout the 15 minutes during our procedure. Next step is to wash our hands. Then we will provide hospital scale if the patient is in the ward. And if the patient is in the private room, don't forget to just close the door. Arrange beddings to expose only part to which treatment is to be given. So we will adjust the beddings. The lower portion of the patient's top sheet or the blanket should be folded upward up to the knees. This is to allow the area, only the patient's body, to be exposed to which treatment is to be given. So next, we will assist the patient into a dorsal recumbent position. So ma'am, may I ask you to bend your knees? Then slightly open your legs. If the patient is unable to go to the bathroom alone, offer incontinent pad and bedpan, then perform the perineal care. So, I see some presence of ointments and soil dressings. So I need as well to do the perineal care. But before performing the perineal care, we will first wear our clean gloves. Then, offer an incontinent pad and a bedpan.
Do the perineal care. So first step is you will going to pour water, then at the inner thigh, then at the opposite thigh. So once it is wet, get 8 cotton balls soaked with betadine cleanser. So the first cotton ball is on the mons pubis, upward direction, from dirtiest to the cleanest. The second cotton ball is from here to inner thigh. The third cotton ball is on the opposite thigh, outward stroke. The fourth cotton ball is for the labia majora, downward stroke. The fifth cotton ball is for the opposite labia majora, downward once stroke. The sixth cotton ball is for inner labia minora, downward one stroke also. The seventh cotton ball is for the opposite inner labia minora. The last cotton ball is for the center, directly to the anus. Then after that, wash with water, separating the majora again. Then the inner thigh, then the opposite thigh. Always make sure that all the soap will be washed out. After that, get again 8 cotton balls. Dry cotton balls at this time. Then dry the perineal area. Dry at a tapping manner.
After doing the perineal care, we will dry it with the use of the clean towel. Then after that, we will remove the bedpan. Then, we were about to place a heat lamp. But before that, we will first remove our gloves. So, we will still place the patient in a lithotomy position. So, the heat lamp will be placed between the knees of the patient at an approximate distance of 18 to 24 inches away from the perineum. Then we will plug So as we can see, our heat lamp is functioning well. And let us assess as well if the patient can tolerate the heat. So ma'am, is it too hot for you?
Yes, nurse.
So if the patient said yes, then we can adjust the distance of the lamp. So we will move backward or a little bit away from the patient's perineum. How about this one, ma'am?
It's okay.
Okay, ma'am, thank you. Then we will cover and place the lamp for 15 minutes. Instruct the patient not to change position nor touch the lamp during the entire procedure. Okay, ma'am. Well, the heat lamp is in place for 15 minutes. Don't worry, ma'am, because I will visit you for every 5 minutes. And I would like also to remind you that avoid moving your legs. Always keep this position all the time. And I'll check for any unusualities or if you feel like burning sensation from time to time. So every time you check your patient, which is every 5 minutes, that's the interval of checking or assessing your patient. So don't forget to check the condition of the patient's perineum and check for any signs of burns. Remember that this is a deep concentrated exposure to the patient's perineal area, and too much exposure can also cause deep skin burns. So always check the area, not only the perineal area, but also the both legs of our patient. So 15 minutes is already over. So how are you feeling, mom?
I feel better.
Okay, that's good. Then we will remove the lamp after 15 minutes as what the physicians order. So I will remove the heat lamp and disconnect it from the electricity. Then reassess the condition of the area and we will check the skin color and any discharges that comes out from the perineum. And we will take note and write it down as part of the documentation. Then after that, we will assist the patient to bed for comfort, to provide comfort. So again, we will assist the patient comfortably. Then we will do aftercare. The heat lamp should be disinfected with alcohol before returning it to the storeroom. Then we will do the documentation. The type of solution given, the length and time of application, the type of heat application, the condition and appearance of wound, the comfort of the patient, and the nurse signature. This is for legal purposes.